Hello, I'm Richie Bowden, founder of SoMoMed. Today I would like to talk to you about the SoMoMed roadmap to build a mobile web application for medical professionals to score and assess patient medical needs. As part of our lean startup process, we've been engaging with healthcare professionals in hospitals, residential care facilities, and community healthcare programs to identify and validate problems with assessing patient care needs. Armed with a detailed knowledge of these key problems and challenges, we are now in a solutions validation phase, but more about that later. Let me move on to provide additional details on the problems and challenges that we've come across in discussions with healthcare professionals, and you may be familiar with as well. In our work with healthcare professionals, we see that patient care assessment is an ongoing process, right through from admissions, through to regular checks during the treatment program, right up to discharge. This is important in assessing the effectiveness of the treatment and the patient's response. In healthcare today, there are a number of challenges, as we know, including increasing medical and care needs from an aging population, along with a financial challenge on how to fund and pay for these services. In this context, the importance of improving patient care and reducing administration is critical. Internationally, this is shown by a 2013 US government report that forecast hospital and home care costs will exceed $1.25 billion by 2015. This is placing a constraint on the time healthcare professionals have to spend and care for patients. A recent US nursing study showed that only 19% of a nurse's time is spent caring directly for patients, with the remainder spent on administrative and support work. I have further validated similar working pressures for nurses in discussions with nursing professionals in the UK and Ireland. Other challenges in healthcare include the appropriate planning and review of a patient's discharge date in order to manage any changes early and effectively to minimize disruptions to patients and to medical staff. And also an ability to perform detailed quality assessments of treatment programs and care pathways based on historical patient care assessment and treatment data in order to plan improvements in quality of care if required. In this context, there are three particular areas that SoMoMed is focused on. The compilation of a thorough diagnosis during the patient admission process and the identification and prioritization of any risk factors. The ongoing assessment of a patient in relation to their planned discharge date to ensure that any changes to the discharge date are managed early and promptly. And the ability to assess the effectiveness and quality of treatment plans for patients generally in order to plan appropriate improvements where necessary. Put simply, our value proposition is to increase patient care and interaction by reducing administration and simplifying assessment processes. SoMoMed achieves this via a mobile patient care management solution for use by medical professionals in acute hospitals and residential and community elderly care practices. This is done through an online library of internationally recognized patient assessment and scoring methods, which can be used to assess specific patient needs, along with reporting, dashboard and analysis tools to enable medical professionals to collaborate on individual patient treatment plans, as well as conduct historical research on the effectiveness of treatment plans on previous patient groups. All of this data is totally integrated with the patient administration system that's used in the particular healthcare organization. We also recognize there are potential financial benefits for healthcare organizations through the use of the SoMoMed solution. These include time savings for nurses, doctors, therapists, and consultants, increased accuracy in patient assessments, eliminating the need for any rework or updates, better coordination of patient discharges, overall reductions in administration costs, and better planning of treatment programs. During our initial pilots, we will be validating and documenting these business savings. In terms of our current plans, our initial focus is in the areas of brain and spinal injuries for rehabilitation care pathways and elderly care programs. We do plan expansion to other care pathways in the future. To date, we are working with 3 hospitals in the area of acute injuries and elderly care in Ireland and the UK. Let's take a look at our current solution plans. Our initial product roadmap involves 2 solutions: SoMoMed Rehab and SoMoMed Elder Care. As you can see, one focused on brain and spinal injuries and the other for elderly care programs. As you can see, we have identified an initial set of care assessment methods the Rehabilitation Complexity Scale and Glasgow Como score in the rehab solution, and the Peninsula Falls Risk and Abbreviated Mental Test score in the elder care solution. Both solutions will be built with ISPAR principles in mind in terms of gathering and communicating patient background information. We're also interested in validating how SoMoMed supports different standards with an initial focus on CARF, the Commission for Accreditation of Rehabilitation Facilities. All the time, these initial solutions, as well as further expanded solutions, will be validated with feedback from medical professionals. As I said at the start, we practice the lean startup approach. So we're using an ongoing iterative solution cycle based on learning from feedback from healthcare professionals and measuring outputs from actual usage in healthcare environments. This is important in identifying critical requirements and ensuring that they are implemented and used correctly. And this enables us to be agile to meet changing healthcare needs. Finally, I would like to thank you for your time to view this video, and I welcome any feedback or comments you may have, either to our Twitter account at SoMoMed Medical or via our online contact page on somomed.ie. Goodbye.